welcome everybody. Thank you all for coming today to the White House. Rising premiums, insurers exiting the states, and non-existent choices. And the statistics are remarkable. Ohio, one of the states represented here, 86% increase in premiums. $2,300 increase in premiums since Obamacare was put in place. 20 bare counties likely next year, meaning that they won't have any insurer at all, and more than half of the counties have just one insurer, and clearly that's no choice at all.
Repealing and replacing Obamacare with something that actually helps impact people's lives positively is not merely a campaign promise. It is an imperative for this president and this administration. Sometimes when people cover stories like this, they'll put you in quotes. They'll call you Obamacare victims in quotes. So we very much appreciate you coming to the White House today to share your stories, your facts, your figures.
And Iowa, 110% increase in premiums.
Fortunately, we were hooked up with a fantastic insurance agent who helped us navigate to get Caroline an individual plan from Wellmark that has been a good plan for Caroline. Wellmark, though, in March of this year said that they were going to withdraw from the Iowa market and no longer issue any individual plans. Thus, 26,000 Iowans were going to lose any options from Wellmark. Shortly after, Aetna pulled out of the market. Medica is the one remaining insurer who says they're in the market, but they have announced publicly that if they're the only insurer, they're going to pull out, which would leave 72,000 Iowans without any option in central Iowa for an individual plan.
I've never been to an opportunity like this, so this is my first. And I shared with them in there that I felt this might be a little cliche, but I felt a little bit like Abraham Lincoln in the Gettysburg Address. This was actually going to be a government by the people, for the people today. Because who am I? I'm just the wife of a Midwestern farmer. I'm married to a farmer, not a farmer's wife, and there's a big difference. One runs a combine and the other one doesn't. But I did feel like that they were listening. I felt like that they were hearing this and weren't just giving excuses for these plans. It is frustrating because I have a health concern of my own that without coverage, I could lose my vision. So it's very much concerning to me what they're going to do. They didn't offer any plans. They didn't offer any inside advice about what's going to happen in the future. But I did feel like we had at least people who were listening, and that goes a long way with me.
Are you looking for more detail?
I think I will look for more details because I won't have coverage at the end of the year. So I'll be looking for a lot at the end of the year.